Are you worried about your loved one with dementia and their safety at home? If so, this is the presentation for you. I'm Dr. Deborah Beer, Director of Special Populations for ComForCare and At Your Side.
Thank you for joining us today. Our presenter today is Dr. Deborah Beer, PhD. Dr. Beer is the Director of Special Populations for ComForCare and At Your Side Home Care. She has a doctorate in therapeutic counseling and a certificate in gerontology, as well as 25 plus years as a psychotherapist and home care director of care. She's also had a part in the development of the ComForCare and At Your Side's proprietary training, Dementia-Wise. ComForCare and At Your Side Home Care is an international non-medical home care agency. We provide non-medical home care and companion and personal care services and specialize in delivering dementia care services. Here's Dr. Beer.
Today we'll talk about the impact of dementia on home safety risks. We'll discuss 4 common safety risks and ways to reduce them. We'll look at how poor judgment adds to safety risks, and then we'll talk about some additional resources. But first I want to say this presentation is for educational purposes only. The information is not intended to be diagnostic or to serve as a substitute for actual medical advice. Seek help from a licensed medical professional for health concerns or diagnosis. You know, the terms dementia and Alzheimer's are very confused with one another, and I want to straighten that out so you know what I'm talking about today. Dementia is a group of symptoms that involve cognitive impairment, and there are many, many types of dementia. Alzheimer's disease is one of those types of dementia. In fact, it's the one we hear about most frequently, and it's the most frequently diagnosed. All Alzheimer's is dementia, but not all dementia is Alzheimer's. Let's look at the impact of dementia on home safety risks. Now, there are plenty of safety risks in the home that all elders are liable to run into. But with dementia, there are extra risks, and they may be different from the ones that are primarily due to age. They may be worse risks as a result of dementia, and they're going to require different safety solutions. Here are some of the ways that dementia increases home safety risks. The first is that people with dementia often have a decrease in sound judgment, and they also have problems in planning safely. They also have confusion, which can add to safety risks. And they also have difficulty following directions, be they written or verbal directions. All people with dementia are fall risks. They have balance and coordination challenges. People with dementia have significant changes in their sensory processing that adds to their confusion and the safety risks in the home. And they have a loss of normal safety awareness, problem-solving abilities, and mental mapping abilities. Mental mapping is being able to visualize moving from place A to place B in an effective way. Let's look at 4 common safety risks and ways to reduce them. I first want to say that when it comes to dementia and safety risks, one size does not fit all, that each person has their dementia in a very individual way, and each home presents very different risks. So we're going to have to find these risks that could be unique and unusual, and the solutions need to be adapted to each situation, not just the home, but also to the person. We also have to respect the elder's life history and preferences when we create solutions. The first risk is about falls. Falls are really the most common injury in any elder's home, and dementia can cause increased fall risks due to a variety of reasons. These include visual processing changes. People with Alzheimer's by mid-disease have lost their peripheral vision. Also, people with dementia have lost their ability to understand objects and what they're used for. And they also have a need for increased lighting. People with dementia have a loss of movement mechanics, meaning that they can't do things that are natural to us, like rising from a chair or sitting down in a chair without thinking about it and having to figure it out. People with dementia also have a deterioration of gross and fine motor control and changes in gait, balance, and posture, all contributing to safety risks. People with dementia have greater fall risks than others, and when they fall, they often are severely hurt. Let's look at some ways to reduce fall risks. One is to provide 2 or 3 times the normal household lighting than you would want. We need to keep passageways well lit and clear. A medical assessment is important to get to determine whether the person with dementia can transfer and ambulate unattended. If the person has forgotten to bring their walker or cane and have walked away from it, bring their walker to them and reinforce their use. Provide either hands-on or standby assistance for transferring and walking. Consider using contrasting colors in a room when you paint it so that the doorways and the windows stand out from the rest of the room. Keep in mind that people with dementia may forget to turn on a light. It's also not helpful to scold or criticize them if they have a shuffling walk or a stooped posture, or they've forgotten their walker and cane. The second risk is burns. There are a lot of environmental risks that become invisible to the person with dementia. They lose the ability to foresee potential problems down the road, to make an appropriate response when there's an emergency, or to interpret if they're experiencing pain and to pull back from something that may be burning them. Here are some of those risks we have to be aware of for burns. Obviously, the stove or the oven, but also the microwave can create burns, as can space heaters, candles or any kind of open flame, a clothes iron, cigarettes, cigars, the outdoor grill, the furnace, garden and cleaning chemicals, as well as auto supplies. To reduce burns, we might want to lock the stove or the oven or the grill, or if it's electric, maybe shut off the power supply to the appliances, or remove the knobs so that they can't be turned on. Remove space heaters from accessible areas that the person with dementia can reach, and allow smoking only under constant supervision. You want to hide your smoking supplies and materials and keep matches and lighters in your pocket. We shouldn't necessarily tell people with dementia to stop cooking because that may be normal and even enjoyable to them, but we want to provide close supervision. We only want to forbid cooking if absolutely necessary. We want to remember to keep flammables locked up and out of reach of the person with dementia. And don't rely on the microwave to solve your cooking problems. It can definitely cause burns and fires. The third risk is poisoning. Here are potential sources of danger. Medications, such as taking too many doses of medications, could be considered a poisoning risk. Household cleaners, spoiled food, house plants, some of them are poisonous. Some hobby supplies are dangerous, plus various products that you would store in your basement or garage. For a person with dementia, the dangers are increased due to their deterioration of judgment and difficulties with rational thinking. Their decreased sense of time and/or place are also a greater confusion. Hard to remember if you've taken your medications if your memory is failing. They also have an inability to follow directions and a confusion over name and uses of objects. To reduce poisoning risks, we want to develop and consistently use a system to make sure that we're not taking double or even triple doses of medication. You want to set up a system so that only fresh or unexpired food is available in the house. And also you want to examine all hobby supplies and materials to determine if there are safety risks, and then provide supervision while they're used. Keep in mind that household cleaners, garden, or auto supplies should be locked up, especially with a person who rummages in cabinets and drawers and closets. And don't scold or shame them if they can't remember or figure out how to follow directions, if they have spoiled food in the refrigerator or even outside of the refrigerator, or if they're disorganized with their medications. The fourth risk is hypothermia or hyperthermia. Hypothermia is being too cold. Hyperthermia is being too warm. And elders are much more susceptible to temperature changes than younger people. And keep in mind, it doesn't require extremes of temperature for hypothermia or hyperthermia to occur. And if older adults who are often a little dehydrated, makes the risks for hyper and hypothermia much worse. The risks of too hot and too cold are greater for people with dementia for a variety of reasons. One is that people with dementia, as they decline, they lose the ability to understand and interpret their bodily sensations and to understand what they mean. They may know that they're uncomfortable, but they may not realize that that discomfort means too hot or too cold, much less to be able to find a solution. That's a problem that we have to bring the solutions to. They also have language disabilities that make it harder for them to communicate to those around them that they're uncomfortable or hot or cold. To reduce the risks for hypo and hyperthermia, we want to make sure the person is well hydrated, either with hot or cold beverages, depending upon what they like and what the temperature that they're dealing with requires. And we want to check the weather forecast together before they get dressed or before they put on any coats to go outside. And then you want to give that person 2 clothing options that are appropriate for the weather. We also want to know the person well enough so that we know that this person happens to run cold or happens to run hot, because we need to understand that their needs for hot or cold are different from ours. We may have to, in some cases, lock, move, or disguise the thermostat if they're constantly monkeying with it and making the house too hot or too cold and therefore putting themselves at risk. Keep in mind that someone with dementia may not be able to figure out the right weight clothing to wear for the weather. That's something we have to help them with by giving them a couple of choices that are appropriate. And we can use helpful hints and comments to guide those choices if they get stuck deciding even between 2 different choices. For example, this blue sweater looks great with your eyes. Or this red sweater is one that your daughter gave you. You'll see her later today. What do you think about wearing that? So we want to avoid scolding or criticizing if they've dressed themselves and we don't think it's appropriate dress. We should not allow the person with dementia to control the thermostat if they can't do it responsibly. There comes a time when someone with dementia cannot be left alone for safety reasons. There will be a point that your loved one with dementia will need more supervision, including up to 24/7 care. As caregivers, we must change how we care for a person with dementia due to the nature of their disabilities. Let's look at how the person's poor judgment can add to their safety risks. And this often comes about at a time when you're trying to bring more safety to the person's home and they're not agreeing with you. Keep in mind, because of their dementia, their inner safety sense has really deteriorated and their judgment overall is poor. People with dementia will often refuse safety improvements because they don't understand the risks involved. However, because they are adults, by default, they are considered legally competent. And no one can force safety on someone who is still legally competent. In a lot of instances, older adults may be in unsafe situations, yet they have no guardian or conservator to help protect them. Here are some ways that can increase the chances of your getting safety changes into a home where your loved one is refusing them. The first is you can try to use persuasion to encourage safety choices. You can also enlist support from people who the person considers authoritative, such as their primary care physician, friends, or clergy, and get them to speak about the safety improvements. You can also ask for a specialized safety assessment, which is something that all of our local offices can perform. something that's not just a safety assessment for an elder, but one for an elder with dementia. And then you want to customize the changes to fit the needs and preferences of your loved one. And if necessary, you can take steps to obtain guardianship if necessary. Those would require legal interaction. Here are some additional resources. If you're a family member of someone with dementia or a healthcare professional who is managing dementia care, dementia caregivers, or families, our local offices can assist you with solutions and strategies for your dementia care challenges. Contact your local ComForCare or at your side home care office for information about our dementia care program. And if you'd like to learn more about dementia-wise methods, such as these that we've talked about today, there are many more to learn. Look for dementia-wise presentations and family caregiver support groups in your area held by our local offices. Sign up to receive free information about dementia care and other information by visiting our websites. Thank you for joining us today.